Hi, my name is Christi Hudiberg. I work for Orlando Heart Specialists. It's a cardiology practice located in Orlando, Florida. We have 9 physicians and 5 mid-levels. When I started with the practice, they were very discombobulated. We had 3 physicians that were using it, 2 that weren't. Staff was extremely frustrated, just wanted to quit, and they had started losing money in their accounts receivables. You know, in looking back at the metrics and isolating where there were issues when I first started compared to where they are now, I can tell you over the past 5 years, we've been able to take our days in accounts receivable down to the best practices. We've been able to turn it back around, and when cardiology has experienced anywhere from a 20 to 37% cut, our practice is financially stable and very viable. We've actually added providers and been able to grow in this environment. When I started at Orlando Heart Specialists, one of my requirements was that they had an additional certified coder on staff. It is so critical with all of the audits coming in, with all of your red flags, that you know what you're doing and that you're coding appropriately and that you're not cheating the system, not because you want to, but because you simply don't know. And so I wanted to make sure that there were other people involved that could go through the physician's surgical reports, that would audit those notes, that would make sure, A, we were billing everything that was appropriate and getting paid for what we did, and B, make sure that we weren't billing something that we didn't do. You know, the greatest part about e-MDs is it's enabled me to show how good my physicians really are and then to improve on the things where we were lacking. Since using e-MDs and pulling in our data reports and our quality reports, we are part of the Bridges to Excellence Cardiac Practice Recognition, and that is put in place by the American College of Cardiology and NCQA. As of the first of this year, there were only 49 physicians nationally that were a part of it, and I had 7. So I'm very proud of that. We also received the Community Quality Award from the Florida Healthcare Coalition. We've been included in some cost savings pilot programs through United Healthcare and Blue Cross Blue Shield. So being able to pull the data, being able to work with the physicians to improve our data, and really guiding them through the system has enabled us to maximize our reimbursements, maximize their time, and decrease their frustration. Looking at the triple aim, e-MDs has enabled us to meet that. We're able to provide the best care at the best place of service at the best time. And as we look at that, we have the ability, if a patient calls in and they're having chest pain and they go to our on-call physician, it's much easier to triage that patient if you know their history and you know if they have GI issues, but their nuclear stress test was perfectly normal and their cholesterol levels are normal. And it allows you, while you never want to assume, it allows you to go through a hierarchy and make the decisions as necessary. Where if they go to the emergency room, where there is no record of the patient's care, they have to start from scratch. So I believe the EHR has really enabled us to improve that care and to be there when the patients need us. I just want to say thank you to e-MDs, because without the program, we couldn't have achieved what we've achieved. I wouldn't be able to go out and argue on behalf of my physicians. In an age where most of the practices are being purchased by the hospital, we are growing, we are adapting, and we are financially viable. And I could not do that if I could not prove to the insurance companies, to the employers, that we are the best opportunity.